Psychosis. Differential diagnosis for psychosis includes schizophrenia, delusions, drug-induced psychosis, bipolar affective disorder, and depression with psychosis. Schizophrenia. Schizophrenia has a history of greater than 1 month. If it is of less than 1 month, then we term it as acute psychotic behavior. It includes delusions, which could be persecutory, reference, or central, hallucinations, which are normally auditory in nature, self-muttering behavior, disorganized speech, delusions of thoughts, insertion, withdrawal, and broadcasting, disorganized behavior such as no self-hygiene, cowardly nature, no job. Negative symptoms of schizophrenia includes lack of motivation, attention concentration deficit, decreased activity. A person with schizophrenia can stand on one leg for hours, can salute repeatedly, can keep looking at roof for hours while lying down. Here's a case scenario. A person with low energy later on starts believing that people are chasing him. He is actually suffering from depression with psychosis. And a person working normally and believing in people chasing him is actually having schizophrenia. Causes of schizophrenia: genetic, brain changes, environmental. Genetic 81%, increased dopamine levels. Environmental factor includes stressors, which could be financial, related to family, etc. Differential diagnosis includes delirium, head injury, drug induced psychosis. Treatment is done by a BPS model. Biological component includes use of antipsychotics, old typical first generation, which includes intramuscular haloperidol, which comes in depot form, easily available and also very cheap. Side effects include extrapyramidal symptoms, EPS, such as dystonias, akathisia, Parkinsonism, tardive dyskinesia. Dystonias occurring in psychosis, eyes are fixed, increased tone, and are acute in nature. In schizophrenia, neck flex to side and drooling present. Akathisia is actually inner restlessness. Psychosis, person may keep walking and keeps crossing and uncrossing legs. Parkinsonism, resting tremors, stoop posture present. Tardive dyskinesia, history of years. Schizophrenic, perioral movements such as rabbit syndrome is present. In case of new atypical second generation, olanzapine, risperidone, and clozapine are used. One side effect of olanzapine is that it causes weight gain. And then these are costly medicines with no EPS symptoms. They may cause metabolic syndrome such as diabetes mellitus, hypertension, hypercholesterolemia. Clozapine may also cause resistant schizophrenia, and it is an MCQ point. One of the many side effects of clozapine is that it causes agranulocytosis, which is an MCQ point. In schizophrenia, medicine course is given up to 1 year. If medical therapy is not effective, then we shift to electroconvulsive therapy (ECT). Psychological component of BPS model uses CBT. Occupational therapy and self-hygiene is practiced. Prognosis is as follows: 30% complete recovery, 30% chances of partial recovery, and 30% chances of chronic stage. Mechanism of transmission is genetic. Care includes dietary modification, exercise should be done, blood pressure should be monitored regularly,